because once
I'm
they hit,
recording. I'm recording it. Are you okay?
yeah, of course.
Okay, thank
So
you.
if you're an Obamacare agent, your focus should be to focus on getting more Obamacare clients and look for ones that are 62 plus. Because then what ends up happening, you start having a pipeline of people turning 65. And so it may not be your main focus, but if you have a lot of Obamacare, you get some free Medicare leads that way that are turning 65. So I know a lot of Obamacare agents that they don't really focus on Medicare other than converting their own book of business to keep that revenue coming. Now, if you focus just on Medicare like I do, so I'm the opposite. I focus on Medicare, but I get a lot of Obamacare inquiries. And so, um, to me, it's the opposite. If I want Obamacare clients, I ask my seniors who their kids are and who their grandkids are. So that's how you work your book of business. You should always be working your book of business and talking to them about new products, talking them and reminding them that you can help with other services, and always asking for referrals of two to three people that they personally know. Not to sell them anything, but just to do an introduction. So Maggie might know this in the life insurance space. It's, called the emergency contact, right? Who's your emergency contact? Same concept that they use in life insurance, you use it for the health insurance. Hey, if you're in the hospital, who would be your emergency contact? Who are the two people you're closest with? And get their names and number, and you introduce yourself as Maggie's health insurance agent, and that they spoke very highly of you as a very good friend, and that if there was ever an emergency, that you would be the person to get a hold of. So, marketing is difficult, but the key is persistency. You have to be persistent, and more importantly, you have to be consistent. You always have to market yourself and follow the rule of seven. That means people have to see your name, hear your voice, hear something from you 7 times before they take any kind of action. That's the general rule. So if you're doing some kind of marketing, you want to do it in the same area over and over and over again until you dominate that area. And get very involved in the Asian community, right? So when anyone thinks of a health insurance agent in the Asian community, they should know who you are. So how do you do that? Well, I don't go to any Asian community events, so I don't know, but I could say they always have business meetings. There's Chamber of Commerce meetings for, the Asian community. There's Asian churches, Asian restaurants. Find out where the majority of the population that you want to target is, right? Get very demographic specific. I have a very specific demographic I market to. I don't deviate from that. I don't market to Mexicans. I don't market to black people. I market to mid to high income white people. That's my market, right? So you have to know who you're marketing to. And they have to relate to you and they have to like you. So people buy insurance from people that they relate, have a good relationship with, but mostly they have to like you. So if you can get them to like you more like family or friend, they're more likely to do business with you. So don't be a transactional agent, be a relationship agent. Take pride in customer service and building that relationship. Should always start all your sales calls by getting to know that person. Hey, tell me about yourself. What hobbies do you like, right? You have kids, you have a family. What's your favorite vacation spot? What's the name of your dog? yada yada, right? Just small things like that. Get to know them and make notes on that. And then next time you talk to them, you ask them about their dog or their sister or whatever they shared with you. That's how you build a long-lasting relationship. And they will not change their agent because of that. So take some experience doing it, but those are little things I would do. I'm not a big advocate of selling your friends and family, but I do think they are good door openers. So they know other people that, you can really your job is to talk to three people every day that you didn't know yesterday. If you're meeting three new people a day, you're being successful.
But Sha is not full-time. She has a CPA, I think a CPA or a tax return work. I think for client, Sha, you should not have you should not lack of a client. The only difference is you need to let people know
Yeah,
about you are doing the Obamacare, you have the license, you have expertise. Even you are new, but your mentor, like Mary, Dr. Lee, or Sava, are very experienced. So Shah, you have a clients, right? The other clients, tax purposes clients.
Mm, no, so that is not for me, but I just help the
Okay.
CPA
Oh,
assistant to prepare the data.
Yeah,
okay.
she's a bookkeeper.
I
Sha,
see. In that case, you don't want to touch their clients. I mean, let's to be
well, here,
Sometimes I touch, but I think
let's hear what Sava say. Yeah.
they are not eligible for the Obamacare. Almost the people there are some the insurance plan
Oh,
uh,
you missed the several
from the
trainings.
company.
Sava showed us a lot of options, not just Obamacare. We are mentioning about Obama doesn't mean
yeah,
it's a
yeah, yeah,
qualified credit.
yeah.
Yeah.
I wouldn't even say the word Obamacare. I would just say
Yeah.
health insurance, right? Because there's a lot of different health insurance plans.
Okay,
Mhm.
okay,
And Shaw, you're in a good position, even though you're not the CPA yourself. You have a relationship with that CPA, correct?
yeah.
So do do they know you can help their clients with insurance related services?
Mm,
You need to have that discussion with them and let them know, hey,
no chance to talk.
why not?
Because I didn't touch the client. I just help the prepare the information.
Right. What I'm saying is that CPA can give you referrals. If he's got the relationships, you're just preparing it, but he's the one talking to them. He can mention, hey, I have a lady I work with that handles health insurance, right? And the Obamacare goes hand in hand with taxes. Why? Because the tax person needs the 1095A form.
This not easy for me.
so Sha, I don't know how much uh Sarah said you get. So let me just summarize it quickly. So Sarah said first you need to let your family and friends know you start to medical insurance. Okay. It is good start point and open the door. And then you need to focus on one area, right? For example, you're in the traffic club, so you can let community people know. So you start Medicare insurance and medical insurance, and people
Oh,
will refer for you. And then also, you can try to learn some new people every day. So Sarah suggests us to learn three new people every day. Then introduce yourself to them. They will know. So you're doing the medical insurance. So probably some of people they need it.
Yeah, and also other professionals don't do what we do. Like a CPA is a great person or a property and casualty agent. These are good people to build a professional relationship with, a partnership, right? So you can have CPAs refer you business because they don't do the health insurance, but you can help their clients get affordable health coverage that will, benefit them on the taxes or lower their costs, right? So that's the point I'm trying to make is, hey, you know a CPA personally, you just need to let them know you can help his clients, right? And if you don't feel comfortable talking to that CPA, well, guess what? You go to the CPA next door and go talk to that one. You're not trying to steal his business. You're trying to help keep that business intact because you can let CPAs know, hey, there's a lot of other CPAs that are getting into the health insurance business. And if they get a hold of your client and let them know they also do health insurance, you risk losing that client because they're going to say, well, I'm going to go with this other tax guy who does it all in house. So it's just another value that CPA can offer his clients at no cost is free Medicare and medical insurance reviews. So it's all about getting a referral, right? Having people send you people, but you're presenting it in a way where it's helpful to them. So Mary's absolutely right. You want to do a lot of community engagement and let people know what you do because how else are people going to call you if you don't have your name out there? And you never know who you will, come across. You will get very lucky doing that. I promise you. Eventually you'll find somebody who refers a lot of business to you.
I think I want to add a few points. Julie is a typical
等
example.
等，
At the beginning, Julie, you can see her face, right, Sha? At
Yeah.
the beginning, Julie has the same thought as you do, okay? Because you don't feel confident about how good you can help. But with this team, what I can assure you, Sha, we can help, you can
Yeah.
provide the optimal solution to your whoever is wanting your help. Okay, so start with that way. Now Julie is not worried about share this with the others. Julie come to the training every time, like with Sava, I know. And with because Sava showed us not just Obamacare, any even supplement health care, any kind of healthcare insurance. He showed us several ways, okay? Because with this broker, we have all kinds of options, and
Yeah.
also we can Sava's experience can help us find optimal product for any client's need.
Yeah. Yeah.
Okay, so that's the confidence you will build. Then once you have
Exactly.
that confidence, you can share. Yeah.
Yeah. Yeah. It's you're not going to have the confidence right away. We don't want you to be the expert Shaw right away. We just want you to be able to have a small conversation and gather what we call the fact finder. It's basic information. You fill out a form and you tell them I'm going to get with my team and I'll get back with you with a solution. It's not like you have to sell them that same phone call or that same meeting, right? You're in charge. So I would say, hey, Shaw, thanks for calling me. Looking forward to helping you. Where'd you get my name and number? Oh, on Google. Awesome. Well, let me get a little information from you. Tell me about your situation. Oh, well, I'm losing my group coverage, or I just moved to Texas, or I don't have health insurance, but I want health insurance now. There's so many reasons why someone would be calling you, right? Write down the reason why they need it. Then you fill out the fact finder, which is on the website that you can gather basic information so we can run some quotes. And then from
And
there,
yeah. And
that builds your
even let me
confidence.
yeah, go ahead. And also, if like you can start with one client, you don't have to provide a solution. Come to this meeting as a case analysis. And that's what we discuss. For example, Julie has several, some of them are Medicare. Of course, Mary actually is more experienced,
Right.
yeah, yeah. So, but what I'm saying is, Julie is similar in your situation like 6 months ago. Yeah, 6 months ago. Okay, Sha. So, but now she can share anything. And plus, in this business, we don't expect within 1 year we have hundreds of clients. But good thing is we gradually, once we earn clients, we keep the clients, and that's called the residue.
Yeah.
The healthcare insurance and
The
Medicare, if we
residuals.
provide superior service, provide good product solutions for them, they don't want to leave us.
No, and that's how you build a good income. It's the compounding interest effect, right, Maggie?
Yes.
It exponentially grows. So the harder you work towards it, the faster you can make it grow. But if you work on it slowly, eventually it will explode, right? Where you get to a point where you don't have to do what we call prospecting. Nobody likes the prospecting part, but that's the necessary steps to get to where everyone always looks at the successful agent and says, "Oh, I want to be like that." But they don't realize what it took for that person to get to that point. It takes a lot of
I
hard
think,
work.
Sava, we can ask Sha how many hours she can allocate. Then, first thing in our agent portal have so many materials. Mary can go
Mhm.
over with Sha separately. We don't want to spend time on this meeting because
Right.
Sava already went over with us, and Mary, you can go over with Shah about the
Yeah.
portal. I mean, where to find what training, what events. You can even register the event by ourselves or went to our WeChat group, ask, hey, I want to go to this event. Anybody else is going.
Yeah.
Some of us, like Julie, go most of the times. Okay. Shah, how many hours in a week, for example, you can spend on this?
I don't know. I think a light time is okay for me.
Nighttime, daytime is Monday through Friday, even weekend, no daytime at all. I'm just asking a question.
Maybe sometimes afternoon.
Yeah, because once we know this, then we can have a right found out which more suitable for you. Doesn't
Right.
matter how much method Sava give to you if you don't have time at all. So basically, it's useless. But obviously, you will allocate some time. I think even the evenings. That's why I'm saying maybe
Yeah.
Mary can go over with you about the agent portal. So many trainings.
Yeah. I have a guy who works full time Monday through Thursday, right? Just to give you an example. And so you have to have your calendar in your week laid out. And I told him, if you're serious about this business, you need to put on your calendar every week which days you're going to dedicate to your insurance business. So he has Fridays off. So he says, I'm going to work Fridays, Saturdays for sure, and then some evenings, right? Like a Tuesday, like a Monday, Wednesday, or one of the days. So he's working 3, 4 days towards his insurance business. And in the evenings, he's making calls because he can't go out in the community because everything's closed, right? And then on Friday, Saturday, he's out in the community. So you got to find a balance. But there's an old saying: calls produce sales, no calls produce no sales. So does that mean physical calls? Yes, but it also means just meeting people. This is a very relationship type business. You have to meet people to get business. If you don't try to meet people, you're not going to get business. It's the same with any business, any kind of industry you're in. If you don't have people that know about your product or who you are, there's no sales. It's the same for CPAs, it's the same for real estate agents, it's the same for any industry. So you just got to know what you're offering and why they should work with you, which is not hard. Now, Julie can tell you a story of an age of a client she had that the previous agent put her on the bat on set her Obamacare plan up horribly, so she had tax consequences. Just because there's other agents doesn't mean they're good. And we don't talk bad about them, but we just show them, hey, I don't think you should be working with that agent anymore. They're making you they didn't even explain how it works on your taxes, and now look, you're paying $2,000 in taxes. I can fix that for you. Don't cancel your health insurance. We can fix it, right? So now you become more of an advisor. And that then you can't no other agent can compete with you. So be confident. You can do it. You got a lot of background knowledge.
Yeah, how about this, Shasha? Let Mary schedule one-to-one with you, Zoom later. Go over with you what
Sure.
she knows about the portal. You have a lot of resources, so that in the evening, you said the evenings at least you can self-study and get over. For example, what Sava mentions, what is a fact founder form? Where do you found it, right? And how to fully utilize the social media. A lot of things on the portal, agent portal, your own portal, you have your own login. You
Yeah.
can go take a look. Okay,
Yeah.
so Mary can schedule a one-on-one Zoom with you, Shasha. Is
Yeah,
that okay?
Okay.
we're here to
Okay.
And
help.
as of now, even today, what we talked, you may not understand. That's fine, but keep listening. Like Judy at the beginning, she doesn't know what we're talking about, but it gradually she knows. Now she know how to approach and how to get started with. Okay, Shasha.
Okay.
Yeah, thank you. So Sava, I think Mary, also Julie has questions. Yeah.
Sure.
Mm-hmm.
Yeah.
Hey, Julie, go ahead.
Okay, I have a question. It's about the same client, the friend I mentioned, and because she don't have her income is change from time to time because it's based on the workload. So when I suggest her to change the income, and she felt not good because she cannot exactly tell what the annual income will be. So another question for her is, what's the benefit if she because she will be she feel uh, currently she put the income is 35,000 uh, for this year 2024 and but maybe she feel probably she will be higher in this value this amount, but she was not sure how much it will be, and also she don't know if she change the income, she will be free for uh, the next maybe 6 months penalty. That
Okay, so here's what I would advise to tell her. So what was her income on her 1040 for 2024? Has she filed her taxes?
um it's she I didn't see the form, but she talked to me is around 40,000.
Okay, so she made 40,000 last year, but
Mm-hmm.
for her application for this year she put 35.
Yeah,
Okay.
35. Yeah, I have saw the
So
documents.
what I would recommend, I always tell people estimate high. Okay?
Mm-hmm.
So if she made 40,000 last year, there's a good possibility she can make 40,000 this year, right? So, you know, I would talk to her and say, hey, I understand your income fluctuates. So does mine, right? And it's
Mhm.
very difficult to estimate exactly. What I would tell her is, hey, if we overestimate, yes, you may be paying a little bit more for your insurance now, but at the end of the year, let's say you put 40, but you only make 35,000, you're going to get money back. So would you
Mhm.
rather get money back or would you rather pay the government like you had to last year?
Mhm.
Right? And
Yes.
so it's her decision. Now, you can update the income as the years progress, but it's prorated. So if you update the income for June 1st, well, she had a lower income for the first 5 months of the year.
Uh,
So you just have to, um, which essentially, if you ever look at a 1095-A form, what they'll break it out by month. So they'll have January, February, March, all the way till December, right?
mhm. Yes.
And they'll tell you how much subsidy you got for each month. So let's say
Mhm.
in January through May, you had 35,000 income. And I'm just making this up. The government is
Mhm.
paying
Mhm.
$500.
Mhm.
So then you go in and you change your income starting June to 40,000. Now let's say the subsidy goes from 500 down to 400.
Mhm.
What that means is for those months prior, January through May, she underpaid her insurance by $100. You've corrected it going from June onwards, but she'll have 5 months where she underpaid.
Oh, okay.
So
Yes.
she's gonna have to pay back those 5 months if her income ends up being actually 40,000.
Okay.
Well, keep in mind that she's self-employed. Now, I'm not a CPA, but to my understanding, if she's self-employed, she can write off the insurance and the subsidy and all that, right? So
Yeah.
that's why I always tell people it's better to just overestimate. Pay more upfront so you don't have to worry about paying it back later.
Yeah, Julie, one more thought here. So we can even introduce some tools help her to reduce her taxable income, right? For example, if we open an IRA for her,
Mhm.
it probably will make her taxable income is 35,000.
Hmm.
Yes. Yes, I suggest uh, for the 2024, the year of 2024, and she already paid the penalty. So, yeah, definitely she will be have an IRA to, to deduct
For
the
2025.
income. So,
Yeah.
Are you talking about 2025? She will open a Rara?
yes.
Yeah, that
Mhm.
will help her a lot. Overall, you need, Julie, you need to have an
Mhm.
Excel sheet to calculate how much
Mhm.
savings by open that IRA or
Mhm.
without open that IRA.
Yeah, yes, yeah, I will have a meeting with her face to face, and I will, yeah, to tell
Did,
her the
did
benefit.
you
Oh,
ever
have
get
a
her
number,
business?
huh?
Oh, I was saying, did you ever end up getting her business, Julie? Were you ever able to change her
Um,
name?
this lady, because her previous agent is very close to her. So when I told her last time, and she, she back and forth for a long time. Recently, she gave me the consent form because she became trust me and can help her, really help her. But she's still have the concern I just told you. So I need to explain more to her. So
Yeah, hey,
that's the issue.
hey,
Yeah.
tell her it's nothing personal. You can still be friends with the other agent, but
Yeah.
you have
You know,
you have a better team. You can offer more,
And
right?
plus, that's why I suggest you have to have the number. Listen, Julie, assuming 40,000, for example, okay? Open
mhm,
IRA or without open IRA, what's the tax credit she can get? That's
mhm,
you need to have a number. Then show her the number. Who cares? I mean, most people will see, oh, I can save $800 by going with you. Who will go? I mean,
mhm,
friendship, yes, they treasure friendship, but money
mhm.
really, most of the
Yeah.
times, because
Y-
it to her, it's no difference. She can treasure her friendship through other way. Doesn't have to be this way, right?
yeah, and that's you have to be careful because there's a lot of agents out there
Mm.
that what they'll do is they'll quote like a Blue Cross plan on Health Sherpa, send it to the client, and purposely put the income low
Yes,
to make it look
too many.
appealing.
A lot of agents like that.
And so us explaining it to them is building more trust and value. Hey, yeah, we're not just trying to get you on the cheapest thing and get your business, and then guess what happens? You don't ever hear from that agent again because they know what's going to happen to them tax time. And she really should be contemplating why she's still doing business with an agent that didn't explain this to her in the first place.
Mm. If from my feeling, and I know she will be, you know,
And you have
yeah.
to be careful, Julie. I don't want you to spend too much time with her because here's what will happen, and this happens to all of us. But this lady sounds like she would do this to you, so I'm gonna warn you. She's gonna use you for your information and then stab you in the back. If you don't know what that means she's gonna use you and then still sign up with another agent.
Yes.
That happens a lot in this industry. You gotta be very careful, and you need to let your prospect. I'm okay. I tell people how I get paid. I tell them, hey, if you don't use me as your agent, you don't let me help you with the policy, I don't get
Yes.
paid. This is how I make my living. So I try to get at least a verbal agreement that they're going to use me because I don't want to spend all this time and energy with somebody who's going to just go sign up with somebody else. They'll make anybody upset.
Yeah. Yeah. Thank you.
Good point. A very good point. Make
Yeah.
that clear at the beginning,
Mhm.
Yeah, yep.
right?
I
Yeah.
would. Before you even do anything, give her some more information. But then you need to have that serious conversation with her. Say, hey, listen, I'm a professional advisor. I do this
Mhm.
for a living. How I get paid is helping people get on the right insurance plan.
Yeah.
And so if you're
Mhm.
not willing to use me, I don't want to advise you anymore. Because you wouldn't do something for free either, right? If it was your livelihood. You
Yeah.
know, I'm not I don't mind giving good advice, but I can't, if I do this for everybody, I just become a charity and I can't, you know, pay my bills and support my family. You got
Okay.
to kind of make them feel a little bad.
Mhm.
Yeah.
So,
That's one of the sales strategy, I think, what to show us shield.
yeah, you know, find what works for you, but definitely keep that at the back of your head anytime you talk to somebody.
Mhm.
Yeah,
Okay.
I've been used for last month. One of the person who said, "Oh, I need the Georgia license urgently because I served her in Texas." Okay, I spent like more than I think more than including my LLC's license plus the continuing education stuff, more like $400. Then a consent she signed. Then I think locally she found someone in Georgia through her church. Then
Mm.
she said, I'm busy, I'm busy. You see, and it's gone. Only for her, I apply license, and she don't care.
Yeah, that's messed up. That is messed up. So, yeah, it happens, but Georgia's still a good state. You'll make good use out of that.
Good. I'm counting. That's what I'm confident on that.
Yeah, Georgia's a good insurance state, good Obamacare state. So, good question, Julie. Does that make more sense? Does that help you?
Yes, this is I'm very glad because I have learned more things. It's complicated case, but I learned a lot. Thank
Yeah.
you.
Yeah, that's where you learn the best is complicated cases.
Yes.
And you need
Mhm.
to feel very confident to share with her about what Sava said, I think. Yeah.
Yes, yes, I get a good point. So I
Hmm.
can, yeah, I know how to do.
Yeah, yeah, people will appreciate you being upfront with them, right?
Mhm.
If you're a pushover, they'll walk all over you, right? You don't want that. We're nice,
Mhm.
but hey, we're doing this not just to help them, but we need to make a living too. So, um, yeah, we're not going to charge them, but hey, we're just not going to give them good advice anymore, right?
Mhm.
Um, did you
Okay.
have any other questions, Julie, or did you have a question, Mary?
Mary
Yeah, I
has
do have
question.
Mary,
Yeah.
I do have a question. So, as the spouse of the veteran, okay. So how can they get better medical plan and the Medicare plan? So I did some research. There is okay, one second. There is the TRICARE
Mhm.
and the CHAMP PVA, but
Champion.
I think probably they cannot get fully coverage. I was told so it does not have prescription or may not cover the
Hmm.
ambulance or other things. So what is your suggestion?
Okay, so first thing I would suggest is everyone should sign up for the Veteran Initiative Program, VIP, on
Mhm.
Empower University. Request that training.
Okay.
It's a very good training. I also have a training channel. Anytime I do my Tuesday webinars, I put the recording in this library. And I had a very good training I did about veteran stuff with Humana. But I'm going to answer your question. I'm just showing additional resources for veterans. Empower has a program just about everything you need to know with veterans. And then I also did a training with Humana about veterans that is very insightful. But short answer is this a real case you have? And does this veteran have use the VA or does he have TRICARE?
I don't know. So what is the difference between VA
Yeah,
and
so
Medicare?
so VA is think of it like a clinic. It's a clinic where veterans can go called the VA, Veteran Affairs.
Okay.
And they're in certain locations, right? It's just like think of it like a JPS
Uh-huh.
or like a Baylor, but it's just for veterans.
Okay.
Okay? And so they had to have some kind of military duty to qualify for the VA benefits.
Mm-hmm.
Not every veteran uses the VA though.
Okay.
But the ideal prospect for insurance is if they're a veteran and they use the VA for their drug coverage,
Mm-hmm.
we can put them on a Medicare Advantage only plan. So it's a Medicare Advantage plan without drug coverage,
Okay.
where they can get a give back plus additional benefits, plus the ability to see a civilian doctor,
Okay.
right? So that gives them access outside the VA,
Mm-hmm.
reduces their Part B premium because they get a give back, plus they get dental vision over the counter allowance.
Okay.
And so they can see a PCP outside of the VA for zero copay. And so they can use the VA for more high dollar stuff, maybe surgeries and all their medications.
Got it. So
And then, Oh, go
Sorry,
ahead.
how about prescription? Because one of my friends told me she need to pay $200
At the
for one
VA?
job. Uh-huh.
Yeah, so sometimes the VA isn't cheap for medications. You can still put them on a Medicare Advantage plan with drug coverage.
Okay.
So sometimes the VA will cover people's medications at no cost or very little cost.
Mm-hmm.
Sometimes there's not much of a savings. So you can look at those medications on just a regular Medicare Advantage plan with drug coverage, and they can join a Medicare Advantage with drug coverage, and they can have drug coverage through the VA and also through their Medicare plan.
Got
So
it.
if they get their drugs through the VA, they go through the VA. It
Okay.
doesn't coordinate with the, um, you know, think of it like everything done in the VA is done in the VA.
Mm-hmm.
So if they wanted that prescription filled outside the VA, well, they got to get the prescription and they can go take it to like a CVS. And then
Okay.
they just pay their copay depending on the tier. So a veteran can have the only time you would sell a veteran a plan without drug coverage is if they're using the VA for 100% of their medications.
Okay.
Otherwise, put the veteran on a regular plan,
Mm-hmm.
if that makes sense.
It does. So then how about tree care?
Yeah, TRICARE is a little more complicated. TRICARE is for people who serve over 20 years or 25 years in the military.
Mm-hmm.
Best way I can explain TRICARE, it works like a Medicare Supplement Plan F with drug coverage included.
Okay.
So they don't have any copays. They have great medication coverage. And so a lot of them are told that they don't need anything else,
Okay.
which may be true. But here's what I tell people. I have some TRICARE people that benefit from a Medicare Advantage plan without drug coverage. They have TRICARE for their drug coverage, but I put them on a Medicare Advantage plan because they value the give back
Mhm.
and they value having the dental, the vision, the gym membership, and the over the counter allowance.
Okay.
The key is you have to make sure the doctors take that Medicare Advantage plan.
Like
Got it.
the Cigna Give Back plan, right?
No, 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 no. Cigna Give Back has drug coverage. You would put them on a Medicare Advantage only plan with no drug coverage. So think of
Which one has the Give Back
Humana.
Part B? Huh?
Humana Honor plan.
Okay.
There's the United Healthcare Patriot plan.
Mm-hmm.
There's the Cigna plan. Oh, if you're in Dallas County or Collin County, Aetna has one called the Eagle plan. All the companies have their version of the veteran plans.
But
Got
those
it.
Part B Give Back roughly how much?
Uh,
1,500?
Humana's is 130.
Oh, not bad.
United is 80. So it just depends. But if you're
Hmm.
doing a veteran plan, just go with Humana or United
Okay. I got it. Okay. Yeah, the Cigna one
for
with the drug.
TRICARE.
Yes. Mm-hmm.
Look at
Got it.
Humana first. The key with the TRICARE people, Mary, is they need to make sure that if you're looking at the Humana Honor plan, that their doctors take Humana. And
Okay.
then those copays would be picked up by TRICARE. So the provider needs to be willing to bill the Humana plan and
Uh-huh.
TRICARE.
Okay. So, let me clarify. I'm processing. Okay, so if they already have a TRICARE, so they can still have a Medicare Advantage plan, and then so the
With no
copay
drug
will,
coverage is the key.
oh, no drug coverage, and the TRICARE will cover the copay.
As long as the providers are in network.
Okay, so then sorry, I missed that. How much they need to pay additionally if they enroll the Medicare?
Well, to get TRICARE, you have to have Medicare. They already
Oh,
have
okay.
AME.
Oh, got it. Okay.
And TRICARE is
You
their
mean Medicare
secondary.
Part A and Part B, right?
Yeah. So
Okay.
a veteran who uses just the VA may not have Part B.
Oh, the A may not have Part B?
No, because the VA will cover a lot of veterans 100%. So some
Mm,
veterans feel like, why am I going to pay 185 if I get all my care done at the VA?
mm,
That's a valid question the veterans ask. And so we tell them, well, because what happens if you're far away from the VA? What happens if you need to see a doctor outside the VA
mm.
or anything else, right? It's added protection. Plus, we can get you on a plan where you're only paying $50 for your Medicare because it has the give back,
Right.
right? So there's nothing to lose, but a lot to gain. Plus, you'll get dental, vision, and so that $50 you're paying for your Medicare will pay for itself.
Okay.
TRICARE, it's a requirement when they hit 65 to get A and B to get TRICARE.
Okay.
And so
Uh,
TRICARE remembers like a Medigap,
mm-hmm.
except why would they go on a Medicare Advantage plan? Well, they want those added services.
Okay.
Which added services? Dental, vision, the give back, the gym membership, the over the counter allowance, hearing aids, all that.
Yeah, I think that's good point. It's easy to sell them if they have the VA, right?
Yeah, easy
And
to
the
sell them if you have.
TRICARE, they have to choose the Medicare. It's just,
TRICARE is a little harder
mm-hmm,
because they're used to no referrals, um, no pre-authorizations. They're used to traditional Medicare. And so the
mm-hmm.
key is with them is you put them on a PPO, tell them you're not going to need a referral. You still have a network with Medicare. Your network's what? Medicare. So if we're looking at one of these plans, we just got to make sure they take Humana or United Healthcare.
Got it.
We already know the doctors take
Mm.
TRICARE, so we just got to
这个是
make
哪
sure
一
they
个？
take the Advantage plan,
Okay.
and then they get extra benefits.
Got it.
And if they don't like it, they can drop it.
Okay.
And it does not affect their TRICARE or veteran benefits at all.
Okay. Cool.
Yeah, there's a big opportunity with veterans. Big, big opportunity.
Yeah, I think so. I have two clients ask about it, but I have no idea.
I would call those clients and tell them, hey, you can help them. Those are
Okay.
easy sales.
Okay. Okay. Okay.
Yeah, yeah. If you can't, text Savva, ask her for help.
Yeah, they might already be on a plan and they don't even know it. We'll find them a better plan.
Okay.
Yeah, see.
So, yeah, those are good questions. Yeah, I'll send the training I did with Humana, but I would also go ahead and request the training on Empower University for the veteran stuff. They go very, very in depth, very detailed on the
Yeah,
key
I found
differences.
it. I already sent the request.
And then you might hear a third one. It's called Champ VA.
Uh-huh.
Champ VA works like TRICARE.
Okay. Yeah, so I saw there is Champ VA and a TRICARE. So there are some article compare the difference there.
They're very similar.
Okay.
Yeah. So if you hear Champ VA, treat it like a TRICARE case.
Okay.
If you hear
The-
just VA, those are the majority of people.
Okay.
Those are the better ones to get. They're a little easier.
Got it. Because they're limited clinics, like
Yeah, well,
limited
they don't have
network.
100% coverage. They're
Yes.
limited. Exactly. Yeah. So they don't get as much benefits.
Mm-hmm. Got it.
I always made the joke. I think about parking just outside the VA and handing my cards out to all the veterans until they kick me out.
Okay. Yeah, I think VA, a lot of people has VA because they do not have a chance to serve the military for more than 20 years or 25 years,
Hmm.
right? So,
Yeah. Yeah,
mhm.
that's gonna be majority of people. There's a lot of Vietnam veterans. That's probably majority of people on Medicare, Vietnam era. Um, so yeah, the big population of them. A lot of them are going to be aging into Medicare. So I don't know. I would find like a commander, find somebody because military people all know each other. They know their squad. So
Yes.
if you can find one person who was in the military, maybe do like a veteran appreciation day where you
Mm-hmm.
have him and invite all his buddies and you treat them to like a lunch or something
Mm-hmm.
and you get to know them and you just tell them what you do,
Okay.
right? That's the best way to get in with the veterans, They don't want to feel like they're being sold, but you can, get to know them and then let them know how you serve veterans, how you help them with their health care.
Mm. Okay, got it. So let me try to connect with people. If I have the enough group of people, I may invite you.
Sure.
Uh-huh.
Yeah, no, absolutely. And keep in mind you cannot sell veterans Obamacare,
No.
unfortunately.
No, yeah.
I hope they change that rule, but we'll see.
Okay.
Great question though.
Okay, so I think I'm good. Thank you so much, Sarah.
Hmm. Anyone else?
Awesome. I also learned a lot.
Yeah,
No?
yeah. No more questions.
Well, awesome. Well, if y'all have any more, you know how to get a hold of me.
Yeah. Thank you so much, Sava.
You're welcome, y'all.
Okay.
Well, have
Yes.
All right. See
have
you
a good
next
Thank you
evening.
very
Tuesday.
much,
Yeah.
Yeah,
Sarah.
have a great evening.
Bye.
Yeah,
Okay,
see
See
you
you
next
next
week.
bye.
Tuesday. Bye.
Bye.
Bye.